Before we continue to talk about how great the Y is, we want to talk about how great one of our members is. His name is Dr. Ben Fischer. You guys may or may not know him, but Dr. Fischer came to us a couple years ago with an incredible idea. He thought, what would it be like if a doctor did more than just prescribe nutrition and exercise? What if that doctor actually went a step further? Now, I should mention that even prescribing nutrition and exercise alone is going further than a lot of doctors. We're up from, in 2000, about 25% of doctors would prescribe nutrition and exercise as something that you can do to better your health. Now we're at roughly at about 33%. So Dr. Fischer was already doing more just by prescribing it, but he said, what if we took it even a step further? Where could I meet my patients and potentially even work out with them and show them what they need to be doing to increase their exercise and to better their nutrition? And so we've been really lucky to partner with Dr. Fischer. Something to note is the Y, as an organization, has tried programs like this in the past, and we've had great success. We've written blog posts about it, but Dr. Fischer has had the most success. And there's a couple things that we could speculate, but I think it probably has something to do with a doctor that truly cares about his patients' health and well-being. And so I want to introduce Dr. Fischer. He's going to tell you a little bit more about what he's been doing here at the Y. So if you guys would, welcome Dr. Fischer with us.
Thank you very much. Thanks, Kyle, and thanks for inviting me here. I'm glad to have the opportunity to talk with you all about health. I know this is your healthcare day, and I'm going to use the time that I have here today to talk to you about the difference between what I'm going to call sick care and health care. And I would argue, in no way disparaging any of the hospitals that you've heard from, that what you've been hearing about, what you will hear about predominantly is sick care, which is a little different from health care, as I'll define it to you. So I'll talk to you a little bit about that. I want to tell you how I've collaborated with the Y. I would just sing the Y's praises. I appreciate the compliment to me, but the Y has made possible the intervention that I've created to try to help my patients be healthier. And then I'll try to close, if we have time, to talking to you a little bit the way that I talk to my group of patients who are actually meeting downstairs right now. So I meet on Tuesday afternoons from 2 to 4. I'll tell you more about that in a little bit. But how I talk to them to try to encourage them to make healthy change, because it's all about seeing the possibility of a better future and then having the motivation to live into that. And so to have a series of little drawings up here, I'm going to start down at this end. So sick care versus health care. Anybody in here speak German or is German or anything like that? Yeah. Are you German or you speak German? I speak German. Okay. Yeah. So one thing I love about German, I'm half German. I should speak a lot better than I do, but I'm passable at it. German is very direct. Like, for example, beef is Kuhfleisch, right? It's cow flesh. Is beef, right? They don't hide behind pretty things. They say it like it is. And a hospital in German is a Krankenhaus, which is a sick house, right? It's an apt description. And health insurance is Krankenversicherung, which is sickness insurance, right? So we have confused our terms, I think, in the United States, and what we're calling health care is actually sick care most of the time. So I'll talk to you about that. And to explain the difference, I'm going to give an example and an apologetic preamble, which I give to all my patients. And since you're not my patients, you don't know me, I'm going to give it here. I'm going to use this term obese, which sounds like a judgment, right? If I use this word, a lot of people perceive that as man, don't call me that. For a doctor, this is just a description of the state of your health, right? And this is out of the 10 patients I saw this morning, 8 of them I talked to them about this. This is the predominant, avoidable, preventable health problem that our country is facing today. So I'm going to give an example of a patient, and this is by no means far-fetched. I didn't see this exact person this morning, but I saw a lot of people just like this person. So we've got an obese, sedentary, 55-year-old male, and these are his series of health problems, his diagnoses, or problem list, as we would call it in medicine, right? So he's got gout, he's got diabetes, he's got hypertension, high cholesterol, he has sleep apnea, he's had a previous stroke. All this up here, I would call the smoke. So this is supposed to be a fire, this is the smoke, right? So when I see this patient, there are a couple different ways to approach this patient. And so I'll highlight those two here. So here's how we would approach it from a sick care standpoint. So this also would be called disease management, right? So probably 2 to 3 medications here. You've got a device to check your blood sugar. Another 2 to 3 medicines here. A medicine as needed when it flares. Another medicine to control this. You've got a medication here. You've got a medical device here. Here's a history of a hospitalization. Here's aspirin or probably Plavix. Another secondary stroke prevention, try to keep you from having another stroke, right? So the disease management would look like this, right? You've got 2 medical devices, you've got 10 medications, you're coming to the doctor quarterly, you're seeing an eye doctor once a year for your diabetes eye check, you're going to the podiatrist that your feet don't fall off, you don't get a foot problem, you're getting a bunch of labs a year. So this is what sick care looks like. And you add all this up, and what happens at the end of this, what am I doing? What I'm doing is damage control, right? I'm trying to mitigate decline. I'm trying to bail out some water from a ship that's taking on water. But what I want to do as a physician, what drives me, that's dwelling up here in the smoke, right? That's treating the consequences of something. And I have always yearned for my patients to be healthy, and I don't like dealing with the consequences of things. I would like to get to the root, right? So if you got to put out a fire, you got to go down here. You're not doing any good up here. So how does this patient look if you say, I'm going to care for your health? Well, it looks like you drag them to the YMCA with you, and you encourage them to come to the YMCA. You have them meet with a dietitian. You have them meet with a psychologist, a counselor, to help them think about who they want to be in the future, how they can inhabit a better future, how they can be healthier, how they can live into that. You get your doctor trying to encourage you to do all these things. And all that adds up to the potential, no guarantee, but the potential to achieve health. Right? The potential that you put out this fire. If you put out this fire, all this goes away. All of it. Right? And then you don't need an accountant to tell you all this is going to add up to also a lot of money down here, a lot of time spent, a lot of money spent, and here you get the satisfaction of maybe you can truly be healthy. And as I do that, I talk about that. It's a little bit hard to define health, right? So what is health? Is this health? A well-managed disease state? I wouldn't call that health, or let's say this person is 35 and doesn't have all this stuff yet. Maybe they have 1 or 2 of these things. Is it just the absence of disease? I wouldn't define it that way, right? So health, one way to say it is the well-working of the whole, right? And this is, I've partnered with the Y. I'm so grateful for them as an organization. They believe in building up the health of the community through building the healthy mind, body, and spirit. And it all goes together. We'll come back to the spirit in a little bit. Right now we're dwelling mostly in the body, but I have an article here written in 1975 by a guy named Leon Cass. A really brilliant insight into it's entitled "The End of Medicine and the Pursuit of Health." And I'm just going to read to you something that's a little bit weird. It's about a squirrel, right? But stay with me here. This is as he is trying to describe what is health? And so here's, sometimes I tear up when I when I read this. I'm not already, but it's really wonderful. So he's just gone through a long academic discussion. This is from an academic journal. What is health? And essentially, I'm stealing that well working of the whole from him. That's essentially how he words it. But it says, thus it is ultimately to the workings of the whole animal that we must turn to discover its healthiness. What, for example, is a healthy squirrel? Not a picture of a squirrel, not really or fully the sleeping squirrel, not even the aggregate of his normal blood pressure, serum calcium, total body zinc, normal digestion, fertility, and the like. Rather, the healthy squirrel is a bushy-tailed fellow who looks and acts like a squirrel, who leaps through the trees with great daring, who gathers berries and covers, but later uncovers and recovers his acorns, who perches out on a limb, cracking his nut, sniffing the air for smells of danger, alert, cautious, with his tail beating rhythmically, who chatters and plays and courts and mates and rears his young in improbable-looking homes at the tops of trees, who fights with vigor and forages with cunning, who shows spiritedness, even anger, and more prudence than many human beings. So, that's health, right? That's a picture of health, and I want all my patients to be that squirrel, right? So I'm trying to encourage them in those directions, so I'm going to, in that spirit, I'm going to talk a little bit more, comparing and contrasting further. We have those two examples, sick care and health care, right? So following from this, here's some differences, right? Sick care is reactive. You get sick and we do something to you. Health care is proactive. We're trying to prevent the problem. Sick care is prescriptive. It's predominantly what is the healthcare system, what is the doctor going to do to you to make you better. Health care, as I do it and try to practice it with the wise help, is collaborative, right? This is you and me together. This is a relationship. I'm gonna give you some advice, but you're gonna take it, right? You're gonna do something with that. Sick care is high tech and modern. I'm sure you've heard a lot about that already. A lot of computer systems, a lot of all kinds of things behind high tech and modern. Healthcare, being healthy has not changed over millennia, right? This is a low tech problem. One of our major problems is we are applying a high tech solution to a low tech problem. These are timeless truths, right? You find out how to be healthy by reading the ancient Greeks. One of my favorites is Hippocrates. Maybe you've heard the Hippocratic Oath, first do no harm. But Hippocrates said many wise things. One of our mantras is two of them are his: let food be thy medicine and medicine thy food. Right? Pay attention to what you're putting in your body. It matters. And number two is that which is used develops. That which does not wastes away. It applies to the body, the mind, the spirit. Achieving good health is about nourishing and exercising your mind, body, and spirit. So those things have not changed. We're not going to find our answers to good health here. And part of our problem, as is some of the out of control costs and all those things, is that we are seeking health here. This is where we're going for health, but this is never going to deliver us to health. And we will spend a lot of time and energy here, and then we'll be surprised, as we often seem to us collectively as a society to express. How is it that we spend more money per capita on healthcare and have the most advanced healthcare system in the world, but yet we're not healthy? Because medicines and surgery are not there to make us healthy. They're there to treat us when we're sick. This involves a lot of systems of care, and these are important. If I told you about, how does sick care look with this patient? When this patient, I described an outpatient setting, managing this patient's conditions, like an inpatient setting, when he presented to the hospital with loss of vision on one side and major weakness on one side. So what is the system's response to that? You have a well-trained EMS person who responds, who recognizes the signs of strokes, notifies the hospital, takes the person to the right hospital that's equipped to deal with that. Hospital receives that patient within 30 minutes. They get a CAT scan. They have a quick enough response to intervene and make a meaningful outcome so that they can do damage control successfully. There's nothing wrong with that. I'm not disparaging that. That's a necessary good in society, right? So we have to have that. But how does it differ from healthcare, right? Systems deliver this, people deliver this. The why and engagement with the population. You know, a doctor, one-on-one. This is a relational thing, encouraging people to make healthy change. How do you measure success of sick care? The ultimate measure of success is, did the person survive, right? Another way to say that is life prolongation. You go into the hospital with a stroke and you come out dead, that was not a successful outcome. If your life is prolonged, that's a successful outcome. I would argue that this is, you know, we spend a lot of time here as a healthcare system aiming at prolongation of life. But what I'm aiming at, it's not that I don't care about that. Sometimes, you know, my interests align with that. But I'm primarily interested in as healthcare in improving life. And, you know, it's quality over quantity. So that's what I'm all about. That's what I'm passionate about. I want to tell you a little bit now about, if we have time here, I'm going to tell you a little bit about specifically how I've done that with the Y's help. I have a few slides to share with you about the program that we've developed over the last, believe it or not, it's actually been 2009 when we started doing this. And so it's been a little while. I first talked to Brad Davis about this a long time ago. I just sat down in a room. Can you hit the lights for me, please? Is there a fountain? Maybe it's all here. Oh, no. Perfect. So, yeah, just had a conversation several years ago with Brad Davis, and then John Mills helped me, and lots of other people at the Y helped me to put this together. So I'm going to move through this kind of quickly because we don't have a lot of time, but I have a lot of collaborators, great people. And this I'm going to move through quickly. I told you earlier that obesity is one of the leading causes of avoidable chronic illness in this country. And it hasn't always been that way. So I'm showing you a set of slides. The darker the color, the higher the percentage of obesity per state, right? So this is going back to 1985. And I'm just going to go through it, and you're going to see what happens. Right? Now this is, that peachy color is a new category. So every time you see a different color, it's a higher category. Right? Now we got... Right. So here we are, right? This is the state of America's health today is that 30% of us are obese, 60% are overweight. The minority of people are a normal weight. So here we are. What does that mean for healthcare systems? It costs a whole lot of money. This is an estimate for how much additional cost there is per person. So we're talking about billions of dollars. I always mention that one man's cost is another man's gain. We have a huge medical industrial complex in this country that depends on us being sick. And there's no conspiracy there necessarily, but you are hearing today about a huge sector of our economy, which I would rather existed to a much lesser degree than it does exist. So we started this program bringing people in 2009. I've been collecting data for the last 5 years or so. This is just an example of what we do. It's a 12-week session. We have right now Dr. Wood is talking downstairs about arthritis. Talk about the ideas. We talk about a lot of disease states, things that could happen in the future, and I try to help people say it doesn't have to be this way. Let's take a different course here, and you don't have to have these things. And we work out with them. The Y provides trainers. The Y's, all these people have a free membership for the 3 months of their time here at the Y, and we measure weight as a surrogate marker for health. Right? We know that with weight comes a lot of avoidable chronic illness, and so weight is the main thing we're measuring, but the main goal we're shooting at is health. Here is just a rundown of our data since fall of 2011. And you can see, encouragingly, if you look at column N is the number of patients per that program. So we do a fall and a spring program. And then cumulative weight loss is amongst all those people. The next column is average weight loss per person. And maybe that's the column I would have you dwell on. So average weight loss total is 9.6 pounds But what I'm encouraged by is that we get a little bit better every time, and I think we get a little bit better every time because we now have, this thing has evolved over time. We didn't used to have T-shirts, so this is why I'm wearing a T-shirt, right? So this is our team. If you see people walking around in red shirts, this is our gang. Part of our gang, in addition to the trainers at the Y, we have 2 psychologists working with us now. We didn't have them before. We've always had the trainers, but we have a little bit more. We have Sherry, one person committed from the Y to this program, and we just really got our arms around these folks, and it's working. Here's one patient. This is not a HIPAA violation. If you know HIPAA, the Privacy Act. There was a newspaper article written about us a couple of years ago, and this is Carson Boone, who's written about it in the newspaper, so I think that gives permission to talk about him. And he's a wonderful person. He's been a long-time Y member. We used to be a little bit more, I used to be a little bit more egotistical. This is retro. It was the Fischer Project before it was the Raleigh Wellness Project. So the Y named it, though. It was the Y. I didn't name it, but I went with it. So he's 82 years old. When he did the program, he did great. He lost weight. He was already coming to the Y, but it helped to encourage him a little bit more. He reduced his blood pressure medications. By his own statements, he felt better. Slept better. It's a wonderful, rewarding thing as a physician to be involved in that kind of a change. And with my last couple minutes here, I'm going to tell you what I tell my patients the first day, right? And this is going to round out with a little bit of mind, body, and spirit. So if you come to me and you say, okay, Dr. Fischer, I confess I'm not quite the person from a health perspective that I'd like to be. I aspire to be healthier. You have sort of that vulnerability of saying that. Well, I say to you, we are all works in progress, right? We are all exist between the tension of who we are and who we aspire to be. And I tell people, if you're perfectly who you aspire to be, then your aspirations are too low. So I'm in this with you. I'm coming with you in this journey. I'm not preaching at you. But so here we are, and the first question I ask people is, why are you here? And I mean that in 2 ways. I say, why are you here? What is your purpose? Why do you wake up every day? What matters to you? What gives weight and shape and meaning to your life? And secondly, why are you here in the program? I know you're not in my program, but I'm just pretending you are. So why are you here in the program? What do you hope to change? What do you want to be better? And why does it matter to you? Because if health is an end to itself, it doesn't give it enough meaning, right? There has to be, why do you want to be healthy? What do you want to do with your life that you can't currently do now? So here's what I tell people. So we're here. We're all on a journey to a destination. And I've pre-filled this out, but I ask people, this is essentially the why are you here? I ask them to fill out for themselves, what gives weight and shape and meaning to your life? What is a worthy life to you? What are you aiming at? And so this for me, I don't know if you can read from the back, be a good husband, father, son, neighbor, friend. The primary relationships in your life. How are you caring for the people around you? Serve well, my God, church. So this is about me. Anyway, that can be personal, but this is mine, not yours. Family, community, employer, employee, your city, your country. And so how are you doing these things? These are the things that I'm a work in progress towards these things. What are you aiming your vehicle at? And your vehicle, how you're getting to these places, this is your body, right? I ride a bike, so I put my bike here. But if you have a car, it's your car. This is your body. We are embodied souls, right? Our bodies are carrying us to where we're trying to go. Your health is the operating condition of this vehicle. Here's scenario number one. A patient comes to me and says, Dr. Fischer, this is what I care about. I care about these things. The body is kind of, whatever. That's not my focus, and I don't want to be one of those obsessed workout moms. I just kind of want to do my thing and focus on this. And I say that's fine. You can you can aim at this, but guess what's going to happen? You know, you're going to be aiming at this, and you're going to go out to your garage excited to go to this destination, and you're going to go and you're going to start your car, and it's not going to start. Or it's going to start, but it's going to kind of rumble along and make this terrible noise and racket, and it's barely going to go anywhere. And you're going to be traveling along, and you think you're going to be aiming at this, but actually what you're going to be thinking about all the time is this stupid car that doesn't work, and it's not working right, and it's distracting your attention. And you think that you're focused outwardly, which I would argue is one of the characteristics of a successful or meaningful life. It's outwardly focused, not inwardly focused. But you're going to be, by necessity, inwardly focused. You're going to be thinking about yourself and your dysfunction of your body. It will become a great distraction to you. And then the other situation is, okay, people come to me and say, gosh, Dr. Fischer, I can't wait to be healthier. I'm just so excited to have a smooth running vehicle and just invest all my energy and attention into getting this vehicle running right. And then it's going to purr, it's going to just run beautifully. I'm going to enjoy the pleasure of driving around in this vehicle. And, you know, that's what I'm aiming at. And, you know, what's going to happen with that is you're going to enjoy driving this car. It's fun to have a nice car or a nice bike. But after a little while, you're going to get sick of it. And you're going to put it in the garage, and you're going to put a tarp on it. You're going to take care, you're going to make sure it's well cared for. But it's not going to be a sufficient thing to make you wake up in the morning and say, I can't wait to do this, you know. A healthy body is an insufficient motive to keep you healthy, actually, you know, sort of paradoxically. So, you know, you need a worthy destination. You need to care about this to care enough about this to want to make it work right. You know, and then the worst one, which is also common, is you have neither a destination nor a working vehicle, right? And that's also very common. Kind of, you're going nowhere in a broken down vehicle. But I think this is a helpful schematic for me to remember to tell people health is an end, or health is a good in life, but it's not the ultimate good in life. It is a good that will help you to live, fully inhabit your purposes in life. And it's very difficult to motivate somebody to a healthy change until you wrestle with this. And once you wrestle with this, then this is okay. And also, what I'm not interested in when people come to me and say, "Oh, you're the guru of health," which is not really true. You know, I don't want to spend 5 hours talking about the perfect diet. That's not interesting to me. What's interesting to me is where are you going? Are you spending enough attention on this to make it work as well as it ought to work, and get it running, and then go somewhere? You know. So now you've been subjected to my first day talk. That's awesome.
Let's give it up. He may not be a health guru, but he did sell his car and only rides a bike now. That makes you feel any better about yourself. But I mean, he did give us some great goals, right? Identify why we exist and make sure that we have the capacity to get there. The why would love to be a part of that journey for you. You may have another resource closer by. Whatever the case may be, know that we're here for you. Sorry we didn't get to spend more time here and see the building, but we've already kept you way too long. So we just want to thank you guys for being here, and know that you are encouraged to walk briskly, maybe get that heart rate up on your way to the bus. We hope you guys have a wonderful rest of the day. Thank you.